Putting on weight, you're tired, you're not sleeping, mood swings, loss of sex drive, go get your hormones fixed.
We get so many questions saying I've had either repeated miscarriages or a difficult time getting pregnant.
I recommend that they're immediately on a methylated multivitamin, do a whole assessment of their diet, pull out the folic acid component. You gotta get away from the sugar. I'm not sleeping, I'm depressed, I have hot flushes, I don't have any interest in sex, and I cannot lose weight no matter what I do. I recommend.
Hey guys, welcome back to the Ultimate Human Podcast, where we go down the road, everything anti-aging, longevity, bio-optimization, and everything in between. This is an episode that lots and lots and lots of our followers and listeners and watchers have been begging for. They said, Gary, do you ever work with women? Do you do anything for women? Because we seem to be male-dominated on our podcast. So ladies, listen up. This podcast is for you. Lots of estrogen in the room today, and very little testosterone between the estrogen sandwich. We are absolutely blessed to have our clinic director, a mentor of mine, someone that has worked in our clinics now with me for more than 8 years. She's a board-certified OBGYN. She's a regenerative medicine physician. She's also a gynecological surgeon. She has 2 master's degrees in functional medicine and at least an ozone certification, a peptide certification that I'm aware of that she got during her tenure with us. And she is a phenomenal, phenomenal doctor practicing regenerative medicine, although her degree is a medical degree. Welcome, Dr. Carrie Carda, to the podcast.
Yay. And I'd like to add, I think you've delivered over 8,000 babies.
Yes, I have.
I forgot to also introduce my wife, Sage Workinger.
I'm
Welcome,
back.
Sage Workinger, to the podcast. So what Sage did was she combed through all of the questions, and there were hundreds and hundreds of them, and she tried to sort of count up what was the most commonly asked question, and we thought we'd target the podcast to some of our listeners' questions. And then we can always do additional podcasts. I love the feedback that we're getting from you guys. You can go to theultimatehuman.com and you can not only sign up for my free newsletter, but you can also submit questions there. And we'll do podcast episodes on just the topics that you guys are fascinated by or interested in getting more information. So
I read through, there are so many female questions because as females, we got a lot going on. A lot going on.
No, don't be so hard on yourself.
So this episode is to make the men out there have a little bit more patience
let's not
for
turn
us.
it into a men versus women
It
thing.
is though. I mean, it's just, this would be good for everybody to just
put up with a lot.
understand what we go through. And I'd also like to point out that a lot of the problems in female lives start with the beginning MEN.
Wow.
Yeah. So we're going to start.
Not much that Dr. Carda can do about that.
We're going to start with menopause.
Can't fix that.
Oh, wow. Did you just make a funny menopause?
So yes, menopause was one of the main ones. Like all these females are like, all the questions. What is it? What does it mean? What are the symptoms? How am I going to feel? How do I get through it? So I also would like to know this because I'm 45 years old and I'm terrified of it. And I think that you have such great knowledge of it in calming our patients down and helping these women get through this miserable time in our lives to make it not so uncomfortable and awful.
No, exactly. I think if I want to say anything, it doesn't have to be that way. No longer are the days you're just getting older, or this is just what happens, or you're past your prime. I mean, it's terrible. I mean, it's terrible.
And so they don't have to deal with it. I mean, there's things that we can do to treat it.
Absolutely not. You do not. There are ways to eat. There are hormones that you can take. It's all about balance. So I think if I could sum it all up in one word, as long as you're in balance, this isn't going to be a miserable process. And as long as people around you are helping you recognize maybe that these men, maybe recognizing that you're different or that something is out of balance, rather than get so frustrated with it, let's go figure out balance.
I like that.
And where do they start? Do they start with a blood test? And what kind of things are you looking at?
So I think we have to understand that before menopause is perimenopause, and which just means around menopause. That's what the definition is. And that generally is about 45 to 50. And it's getting younger and younger as time goes on because we're so out of balance. Our diet, our our weight, all those things affect our hormones. And I think that we need to know that every organ system in our body has receptor sites and cellular sites for hormones, right? And hormones are not just estrogen, progesterone, testosterone. There's also thyroid. There's you have to understand that it all has to match.
Right.
And so I think first it's going to be diet. I think nutritional deficiencies are going to be one of the biggest things that you can do to help yourself. And then probably the number one cause is going to be stress. So if I had to list the top 10 causes of perimenopause, stress is probably top 5, right? We're not going to be able to avoid that we age. That's the one we can't do anything about, but we sure can go down fighting.
Yeah,
Right.
you've helped so many of my girlfriends. I mean, literally their feedback is that when they talk to their girlfriends, when they got on a good protocol with you, they talk to their girlfriends who are going through it and they're like, why? Why go and suffer? I feel great. I'm not having the hot flashes. I'm not having the anger or the, temper issues. But so what are some of the corrections?
So pretty much you can guarantee about 85% of women are going to have the hot flashes. That's your first tall tale sign. Sleep disorders, depression. And I don't even like to use and call it depression because it's really hormone imbalance. And
Right.
but I think in general, they feel like they're getting depressed or just lack of luster, certainly loss of interest in their libido.
Yeah.
It just that just goes out the window. So if you're having hot flashes, if your sex drive is down, if you find that you're not sleeping as well, if you're more irritable, then please check your hormones.
Right.
Please do that. We have an amazing program, I think, that looks at each and every one of them. And you can kind of see where a woman goes out of balance. And I don't know about you guys, but I'm so shocked at how that age is getting younger and
Oh, yeah.
younger and
Yeah.
younger.
And I know that from working with you and seeing you treat so many patients, some of the fixes are relatively simple. We have so many women that come in and they're either pre or perimenopausal, or they're just even before that stage, and weight gain has been a huge issue for them.
Yes, that
And
belly, middle
that
weight
estrogen
gain,
band.
or how many women have told us they just feel like they're retaining fluid,
Right.
right? That's generally, it's not that they're drinking more, it's not that they're voiding less, it's that they're literally collecting fluid, mostly in their gut in that middle belly area.
And a lot of that has to do with the estrogen dominance,
Absolutely.
right? Because,
Absolutely.
and I know when we look at labs very often, when you get a hormone panel, your hormones could be in the right range, but meaning it's perfectly normal for women, depending on where they are in their menstrual cycle, to have estrogen, let's say in the teens, and it's perfectly normal in other parts of their cycle to be in the 400s. But it's when it gets out of ratio and out of balance, which is, I think, what you're referring to.
Correct. Or that estrogen dominance, like we talk about. And that's what you'll generally see. I see just terrible progesterone levels and I see these high estrogen levels at the wrong time of the cycle.
Right.
And we have to remember that estrogen is a hormone of growth. It's a hormone of stimulation. It's a hormone of holding onto water and feeding the fat, where progesterone is the opposite. They're yin and yangs to each other. And then you have your testosterone coming over and women need testosterone. We always think of that as men.
Yeah.
Right? And the first thing that goes in women is their testosterone and their progesterone. It's the first thing. And generally, because you're shuttling it all over to adrenaline and cortisol and dealing with, getting up in the middle of the night or no sleep or things like that. So we sacrifice our progesterone and we sacrifice our testosterone.
Right.
And what's left? A ton of estrogen. Plus, if we start as we age, our weight ratios do tend to change. And we know our society, our weight ratio is tending to change, a little more adipose tissue. And that feeds that estrogen even more.
I've noticed that I've had personal experience working with clients, with you managing their case, and I've seen miracles with simple changes. I'm not saying this is the simple change to all estrogen dominance, but I've seen women come into the clinic and say, "I just don't get it, Dr. Sarda. I wake up in the morning, I'm fasted, I go to the gym, I do Orange Theory 5 days a week. I've been watching my diet, and I've been doing this for 3 or 4 months and I haven't lost a single pound. And then you look at their hormone levels and you see that their estrogen is way out of whack to their progesterone. And I've watched these women that take simple things like DIM, diindolylmethane,
Absolutely.
and the progesterone capsules, you put them on at night. And within a few weeks, sleep's restored and the water retention is off. So it's not always a massive intervention with hormones and a complete sort of takeover of their system. Sometimes it's just little guardrails.
Little adjustments. And it's not forever either. If you can get somebody balanced, and usually realistically, probably 4 to 6 months. If you've messed your pattern up, it's going to take you a second, but it's not forever. So if you just bathe the body with a little bit of progesterone, especially at night, it helps you sleep. It's very calming, very, very calming. It just slows the brain down, slows the mind down. I love to, as you well know, to use progesterone at night. And notice also, a lot of women won't talk about this, but they have terrible vaginal dryness and terrible trouble with intercourse. And if you just add in a little bit of that progesterone at night, and sometimes even more, but a little bit of even estrogen too. But in general, if I just get the progesterone up, I use the DIM to make sure that they're breaking their hormones down correctly. They feel great.
Yeah.
They feel great.
Hey guys, I think the most important website you may ever go to is theultimatehuman.com. That's theultimatehuman.com, because on this website, we can directly interact with one another. You can give me suggestions for podcast guests and topics that you'd like to see me cover. You can ask me any question that you'd like. More importantly, you can sign up for my entirely free newsletter. It comes out every single week. I write this so I can get the information to the masses on how to live a healthier, happier, longer, chemical-free life. You can also sign up for a pre-order of my book. And if you'd like to take the genetic test that I talk about all the time, it's available there too. And lastly, you can even see all of the products that I use in my daily life for a chemical-free, healthy living style. A lot of people ask me, what do you use in your daily life, Gary? What do you brush your teeth with and clean your countertops with? Well, it's all there if you'd like to see it. And you can, again, ask me any question that you'd like and get my free newsletter. theultimatehuman.com. I promise you that information will help change the trajectory of your life. And now back to the Ultimate Human podcast.
I notice sometimes you have these women, you'll do a basic hormone panel, and then sometimes you'll take a deeper dive and you'll do something called a Dutch panel, a Dutch test, which is a 24-hour or 48-hour urine test. And you'll really look at the cycle. And an interesting crossroad between Dr. Carda and myself is, I've really dedicated the balance of my lifetime to studying genetic methylation. You've dedicated your entire lifetime to studying, the female body and delivering babies. But interestingly, there's an intersection here because there's a gene mutation called COMT, COMT, catechol O-methyltransferase, and it appears on the Dutch test, and it's part of this estrogen metabolism. I think it sends estrogen down the E2 pathway, and if that gene mutation is present and you're not supplementing for it, isn't this a part of the reason for the rise, the accumulation of estrogen not being rid from the body?
Right. So if you do not get rid of your estrogen, you will literally reabsorb it and recycle it. So you also, even more important than that probably, is the fact that if you don't go down that right pathway, you will go down a more dangerous pathway in estrogen. So in other words, we start worrying about estrogens that change DNA, estrogen dominance, and then you start worrying about breast cancer, uterine cancer. Estrogen needs to clear the healthy pathway, and it needs to be eliminated.
Right.
And when you have that COMT SNP, that COMT gene, you need to pay special attention to that. You need to make sure you have your nutrients, your B vitamins, and things like that, because you need to help clear estrogen. And you also need to watch what kind of estrogen you're consuming.
Right.
Well,
you
big
mean if
thing-
they're taking hormones?
A big thing that you helped me with, and this was 3 years ago when I dealt with my methylation imbalance, was I have the COMT break. I was supplementing with the vitamin that had folic acid and cyanocobalamin, both synthetic vitamins I cannot process. And my estrogen levels, and when I look back at the lab values, I'm like shocked by it, but it was 700% estrogen dominant. I was a crazy person. And I remember I had that little gut, which
I actually vividly remember this.
I know you do. It was a beautiful moment in our relationship. But you truly helped me get through that and it was just a short course of a little progesterone and
DIM, I think.
DIM.
Diindolylmethane, yeah.
And it got
Which
me
comes
through
from
it.
cruciferous vegetables, by the
Yeah,
way. Just in case
supernatural.
you're
Right. So
wondering if
remember
that's
that. Remember, you can
that's
also eat to
pharmaceutical.
this too, your
Yeah.
vegetables. And we kind of laugh about that time that you were
Yeah.
going through, but unfortunately,
You two laugh about
Yeah.
that. Yeah, okay. Let's just
but
clarify.
unfortunately, there's
It happens to so many people.
So every day,
Yeah.
all day long, it's just we can fix this.
Yes, which is why I
And-
like to talk about it and lay my crazy
Right.
out for everybody, because I know that if I share that story, somebody else is going to raise their hand and go, well,
That's
that's
me.
happening to
That's
me
me,
too.
right.
I'm not crazy.
Right.
Let me get my labs checked. Let me talk to my doctor about it. So
And I think it's also important to know that if you don't fix this, you guys, it's dangerous. It is dangerous. It's dangerous for dementia, your relationships, your inflammation, and we all know what inflammation. You could get cancer. I mean, it's
Yeah,
just
and your
it's-
mental well-being.
It absolutely, and of course, your sexual wellness is important. It's so directly related to your hormones. So it's been a big focus of mine to balance hormones. I use bioidentical hormones. So in other words, I use it, and we're pretty strict about that because we want hormones that your body can recognize. It's hard on the body when it doesn't really know what to do with a substance, or it's like mimicking something. You already have to detox and process so much. So we do like to do bioidentical hormones, and there is bioidentical estrogen, and there is bioidentical progesterone, and so that would be my
And
recommendation.
bioidentical testosterone.
Correct.
And I've also noticed that sometimes you'll use as a part of this balancing process to getting progesterone and estrogen into balance, using things like DIM from cruciferous vegetables and progesterone at night, but also looking at their testosterone levels, because remember you telling me that when women get very deficient in testosterone, we've seen this on hundreds and hundreds of labs, their red blood cell production tends to decline, their hemoglobin levels tend to decline, not to the point where they're anemic, but to the point where they're tired and they have brain fog and they're not sleeping deeply. And I've watched what you've been able to do with minimal amounts of intervention, just balancing testosterone alone, moving that back into the optimal range for a woman, which I think a lot of women are, resident about, thinking about taking testosterone. I don't want to get male characteristics and big muscles and facial hair and aggression, but putting their own testosterone back into a normal range.
And the biggest thing with that, my push for that, and my demand for testosterone being a part of it is your brain. Is cognition is so important to protect it with, and testosterone is how you're going to do that. So I definitely consider all three hormones, and I think that doesn't happen often in the traditional model that I was trained in. It was the lowest amount of hormones for the shortest amount of time, and all the studies, the big studies, Women's Health Initiative back in the mid 2000s, all those studies were based again on synthetic hormones. Studies have long since shown that if we stick with these bioidenticals, since about 2017, it's generally been more accepted that hormones are good, and there's not an age limit, and it doesn't matter if you're 65 or if you're 70, or if you don't have hormones, let's give you hormones.
Right.
Let's give you testosterone. Let's give you estrogen. Let's give you progesterone.
Makes you feel
and
better.
we're not going to do it at pharmacologic levels. We want to do it at physiologic levels.
Yes.
Right. That's what we're so big about, is restoring physiology.
Yeah.
In our lab work, we trend, right? We follow trends. We don't want to wait till you're there.
Right.
So that's all I'm asking, is that women don't wait till you get all those symptoms. The second you get them, you might be 35. You might be 30. If putting on weight, you're tired, you're not sleeping, you have mood swings, loss of sex drive, go get your hormones fixed.
And is there a way to better eat for hormone balancing?
Yes, absolutely. I mean, hands down, you got to get away from the sugar. I mean, just hands down. And for many reasons, besides even just hormones, and you have lots of podcasts about that, your gut health and sugar. But sugar is just makes your brain and your hormones crazy. They just do. I think the part we're missing is we're not getting enough fats. Our omega-3, especially for women. So for food-wise, avocados, fish,
Coconut oil,
coconut oil, wonderful, olive, right?
nuts.
Lots of nuts, yes. But you know what? If you're not going to do it, then take some omega-3. So I think nutrients are. I think we would be not fair to women if we didn't at least address that we're short on our omega-3. We're generally short on our vitamin D, our B12.
Sometimes DHEA.
Correct. DHEA, that's, over the counter. That's, DHEA is a great way. It's a pro hormone. It's before the hormones. And if you don't have the pro hormone, how are you going to make the hormone?
Right.
And then I also really, in my practice in the last few years, I've been doing a little bit more iodine just to make sure I do that in the form of Celtic sea salt, or you can do the Himalayan sea salts. But I do that's all interplayed, because as soon as you mess up your traditional female hormones you're thinking of, what do you think's next? Your thyroid. And and everybody always wonders because they're connected. It's your thermostat.
Yeah.
And it's
The
connected.
pituitary regulates all of those,
It
right? And
does.
it's kind of the master puppeteer, regulating a woman's menstrual cycle, regulating a woman's thyroid level, regulating your body temperature, your metabolic rate.
So is that why hot flashes happen?
Yes, it has to do with having an abnormal feedback. And so you just literally, you literally don't, it's that progesterone estrogen imbalance that does it. And that's where you get what are called vasomotor symptoms, or just changes in your blood vessels and things like that. And we have to, we pay a lot of attention to hot flashes. What I don't like is people think, oh, I got through that. I don't have hot flashes anymore.
Oh, so that they're over with that.
All that means is that you don't even have the ability to mount that response anymore. You're just sicker. So I spend a lot of my day explaining to people, you don't really get through being deficient. You either correct it or you don't. And if you don't correct it, it gets worse. So I think the biggest fallacy that has somehow been created, and I think it came through the traditional model, because I remember how I was taught, was, okay, so 50 to 55 or something like that. But again, it's because you're not flashing anymore, just means you're sicker.
Yeah. Doesn't mean that you've gotten through it.
It doesn't mean
and it's in
you don't
rearview
get
mirror.
through menopause. You
That's a
have to
great
fix
point.
it.
Is it funny that I actually look forward to menopause because I run so cold? Like my hands are so cold right now,
They are.
always. And it always has been that way. And so I laugh. I'm like, I feel like I'm going to look forward to hot flashes, like not being freezing all the time.
I still think you could make an argument for the fact that if you are abnormally cold, or I think again you have to go back to, what is it about your internal clock? What is it about your homeostasis that keeps you cold? For you, you don't have a lot of thermal regulation. You don't have a lot of fat, but also we have to look at your thyroid, right? Because
My
that's
thyroid,
controlling
I think,
your
is good. I always wondered if I
temperature.
had Raynaud's syndrome.
You could.
I don't know.
I think again though, you still have to look at, am I balanced? Where am I balanced? Do you have enough iodine? Or do you have enough selenium? Are you supporting your thyroid enough? Are you converting from inactive, even though your thyroid might look okay?
Yeah.
Do you really going from inactive to active? We talk a lot about folic acid going to folate. It's that same concept. Do you have the good stuff? Do you have the active stuff?
Right.
Okay.
Your body doesn't
Meaning
recognize that
like
stuff. It
the-
has to activate it.
The
right?
T4 into T3.
Right.
The thyroid hormone T4 converting.
Right, because
the thyroid hormone
T4
T3.
is just a reserve. It's T3. Every cell on the body has a T3 receptor. Remember, we said it's your regulator, right? And for energy, metabolism, temperature, brain. So we have to make sure that it gets those cells get full, and that happens in the gut mostly. And where is it
Liver,
that we have
gut,
all the
periphery.
trouble? Gut,
Gut.
right?
Yeah.
And what's that from? Diet,
Right.
right?
And when we say gut, it's the gut region. A lot of it is converted in the liver, T4 into T3, some of it in the gut, the actual intestinal tract, and then some in the periphery, just to be hyper specific. But that gut region, meaning that it occurs outside of the thyroid, right? So
Right.
I think a lot of times when you look at panels on in your blood work and you see, oh, I have low thyroid hormone, and you immediately think thyroid. But the truth is that 80% of that thyroid hormone is actually converted outside of the thyroid,
Right.
liver, periphery,
Right.
and also the gut, which is why gut dysbiosis can lead to thyroid problems.
Right.
And the two seem so disconnected. There was actually an amazing book written by Dr. Ron Perlmutter called The Gut-Brain Connection
Right.
and the Gut-Brain Axis.
David
And
promoted?
Dave Perlmutter, sorry.
Yeah.
No, Dave Perlmutter, sorry. And he's from Naples, where we started our clinic. And it's a great read if you haven't read that book. But I mean, he really goes deep into the science of the gut biome and what happens in the gut region and its impact on hormones and what have you. So I love this whole systemic approach that you have, because it's not always going straight to hormones. Sometimes it's putting up the guardrails, DIM, DHEA, selenium, the things that your body needs to do its job on its own. And then we also have the capacity to intervene with bioidentical hormones when things are not responding. Right.
Right. And you will reach an age, all of us will eventually, where your ovaries aren't putting out hormones anymore. Now, they will, I think the misconception about the ovaries is they will continue to eke out a little bit of testosterone. That's kind of chronic. That doesn't really ever go away. And that's kind of what's supposed to be there for you in your menopause years, although we just traumatize our bodies too much and we don't always get that production. But you do continually make a little bit of testosterone throughout your life, even at menopause. And then in general, your diet, your periphery, your fat cells, your adrenal glands, they're supposed to take over for the hormones that your ovaries aren't making anymore. And that's kind of where the big mishap happens, is we just don't do that well anymore. We're under too much stress. We're exposed to too much toxin in our diet and just in our environment. And so much of what we are around acts like estrogen. We call they're mimickers.
Oh yeah, no,
right?
the estrogen makers.
Right.
Yeah,
In our meats, in our right,
or
right,
BPAs.
plastics, right.
What about soy?
So soy, for a long time, was and consumed organic and in the right amounts, did a beautiful job.
Okay.
Unfortunately, so much of our soy
GMO
is not so good, and we're getting too much, and yam, things like that, or other things that can kind of give you an estrogen boost.
Yams can too? Oh, I didn't
Yams
know
can
that.
too. It's the problem is we've just altered our food source so much, and I do think that it is hard at menopause to eat enough to make up your hormone difference. I
Right.
do think it's time to get help.
Hey guys, if you've been watching the Ultimate Human podcast for any length of time, you know that one thing I do not do is push products. I do not just let any advertiser into this space, because I believe that the products that appear on the Ultimate Human podcast should be things that I use every day in my life to improve my own physiology. One of them is something called the Echo Go Plus. The Echo Go Plus is a hydrogen water generator that you can take on the go. You essentially take the top off of this bottle, you pour bottled water in this, and repeatedly it will make high part per million hydrogen water. You press this little button, you'll see these bubbles going up in the water. That's hydrogen being created in the water. There are all kinds of peer-reviewed, published clinical studies on the benefits of hydrogen water, including reduced inflammation, better absorption of your supplements, better absorption of your foods, better balance of the stomach acid, and it feeds an entire class of bacteria in your gut. Hydrogen water, in my opinion, is the most beneficial water that you can drink, and now you can take it wherever you go. You can go to Echo, ECHO, H2O.com. That's Echo, ECHO, H2O.com. Enter the code ULTIMATE10 for a discount. Echo H2O. Enter the code ULTIMATE10 for a discount. And now back to the Ultimate Human podcast.
So if somebody wants to, if they're going to go talk to their doctor about having a hormone panel done, what hormones are they looking at? I mean, most physicians, would they know, primary care doctor, would they know what hormones to pull on a female? Because I know they're not a part of a standard blood panel.
Right. They generally have to be extra. And a lot of times you'll see estrogen and progesterones and you don't see testosterone drawn. And you don't see the sex hormone binding globulin drawn. And that's important because it is what it says it is, sex hormone binding.
Right.
So you might have an okay level on your hormones and it's all bound up. It can't get to that cellular receptor. So SHBG, or sex hormone binding globulin, is another one.
And I noticed that sometimes you'll specifically address the SHBG level in a way to address the hormone level. So when people are not converting testosterone into free testosterone, for example, this binding protein, which is a sex hormone binding globulin, is a protein, and when it rises in the blood and gets to a certain level, it's relatively easy to push back down into the normal range, and then their hormone levels have a tendency to come back on their own. I've seen you do it thousands of times.
I use a lot of long jack. I like to use that. We've had medications over the years, but I think we all would rather maybe do it a little more natural,
I've seen you
less
use
side
boron
effects.
to bring down
Boron,
SHBG.
yes, boron
long
does as
jack.
well, long jack, and it does it very quickly, 14 to 30 days, 45 days. It'll drop down. It'll just free up more hormone.
And they always say their libido came back like a freight train.
Yes, yes.
Well,
Yeah,
one time I
remember that.
did, my testosterone was low, so we tried to do a shot, and it actually messed my methylation up, and so it didn't work for me. Which is why I think it's important too to, like, I've never promoted anybody to do the pellets, because I've seen so many women where it was like the testosterone was too much, or, and then you're stuck with it for 6 months or whatever. So I like the idea that you could do an injection, or you could do a pill, or a cream.
Or dissolve under the tongue.
Yes,
You,
so that
you,
you
you
can
can definitely
calmly go through it.
Definitely with those short-term methods, you can control and have pretty good control of the dosing, and you can adjust accordingly. So that's the nice thing about doing those methods over the pellets. You are for at least 4 months. You're pretty much going to be
Right.
stuck with your dose. They are getting a little better, I think, at looking at labs and formulas and trying not to just pound these women with levels, but if you have extra testosterone, you can get a little roid rage here.
Yeah.
Yeah.
Love it. So the alpha, or the long jack that you were talking about, so that's something females could try too?
Yes,
Okay.
yes, it is. Because really, it works for both males and females, because by just lowering the binding up, you're going to just free up hormones. So in men, that tends to free up their testosterone, and women, that tends to free up their progesterone and their testosterone. And
I might have to
What
try
were
that.
some of the specific questions that they had?
I had another question about, you touched on it a little bit earlier, anemia, and but maybe like talk about heavy menstrual cycles.
yes, yes.
and-
No, I'm so glad you brought that up, because I think that's forgotten too. That's why iron becomes such an important, and eating foods with iron in it, your leafy green vegetables, things like that.
Grass-fed
But
meats.
we want to, if you're especially menstruating, there's a lot of people, and there's some pretty decent data around menstruating women should all just be on iron, or at least during the time that you're menstruating. About 30 milligrams of elemental iron is what you're looking at. We like the iron bisglycinate because it just absorbs so nicely, and you
And we
don't
got
have
less reports of stomach upset,
Right.
less reports of constipation, and it was iron bisglycinate.
Right. That's the one I love too. That 30 milligrams at least of elemental, and you can take that during your menstrual cycle. That works well. You can, and at the time where you start to lose your menstrual cycle, you still have to remember that you still need oxygen and you still need iron. And with that, we need our folate, right? So we would be folate and iron, and again, our vitamin D. The nutrient supplements are going to be, if we can't eat it, you're going to have to supplement with it.
Right.
And touching on that, if you could kind of go over the differences between folic acid, folate, and folinic acid.
So they're different forms of
And vitamin B9.
Right, vitamin B9. They're different forms. And it has to do with their availability or their bioavailability. So we know that the folic acid, for many of us, at least 25, we think, percent or more of the population. And I think that's really
Yeah.
I think that's really
Yeah, I read-
underestimated.
We actually, when we were doing some research for the book, we found studies as
high
low
as-
as 44 and as high
high
as
as 60.
60%.
Right. That
the
you see those.
population
It's
For
definitely
MTHFR.
cannot process
they just
folic
can't.
acid.
They just can't process. And honestly, even for those that that can, it's still just extra work.
Yeah.
Right. It's extra work on the body.
Right.
We can't have enough. We got to do.
So I remember sending you both an article that I read. It was on the CDC website. And in the same article, and I actually love to
remember
re-find
this.
this. In the same article, it admitted that people with MTHFR gene mutation cannot process folic acid, and it would be better for them to just take 5-methylfolate. But in the same article, it then said,
True story.
but if you're pregnant or nursing, then you should, even with an MTHFR gene break, take folic acid instead of folate. Why in the world would they say that?
Right. So
why not just recommend
I think
folate?
anybody out here with common sense is going, what? But it's what the studies they're just it's what the studies have been done on. Studies have been done on folic acid. There's quite a bit out there for the benefit that occurs in pregnancy if you have, but it's folate.
Yeah.
Right.
At the end of the day, they really talk
right.
about folate. It's just
The
whether or not your
studies
body.
have not really been done
Yeah.
on methylated
Yeah.
B9, and so I think they just kind of copped out there a little.
I get a lot of people that fight us on the folic acid thing, like especially, and I hate to say this, but my nurses, friends of ours, your daughter and son are both in nursing school, and they just push heavily on the folic acid thing. And we all just kind of laugh. And she literally has to, Madison will take a test, and she knows she has to answer
just to
how,
rethink it.
Yeah.
Right.
She has
right.
to answer it how they want her to answer
But
it.
look at the
not how
cost
she
difference
would want
in
to. Exactly.
folic acid and folate. Look at especially in the traditional model. It's all the studies are based on that. All it's, and I think that needs to change. I think it is changing.
I think so too.
I think that it makes sense if I have to do the extra job to activate something, and geez, I might not even have the ability to do that very well. Maybe I'm
Right.
only 40% or
So in other words, take the methylfolate
right.
rather than the folic
and
acid.
it's so easy. It's so easy to do.
It's getting easier and easier. It was hard to find methylated multivitamins.
That was
and
a
now-
big
I remember
issue.
when we first started 8 years ago,
Right.
we couldn't find it anywhere. Even
Right.
when we went to manufacture our own vitamin,
They tried to push.
they really did. The manufacturer really pushed us to not use it. And he said, I can get cyanocobalamin so much cheaper. It's so much more bioavailable. It'll lower your per capsule cost. I can get folic acid.
That's what everybody else is doing. That's what they told us. And we're like, yeah, that's precisely why we don't want to use it.
Exactly. Now there's lots of good brands that have methylated folate and don't have the cyanocobalamin. They have the methylcobalamin.
But we've also had patients that when we go through their medicine cabinets and they have an MTHFR gene break and some of the other ones too, I've been shocked that literally we had a patient who was prescribed a pharmaceutical prescription grade
Folic acid and cyanocobalamin.
folic acid cyanocobalamin combo. I'm like, no wonder you're nuts.
And she would take it in the morning, and she had to take Xanax or Valium by the afternoon because her anxiety was so rampant.
Through the roof.
And
Sad.
the recommendation was just to get off
Just
that.
hate to think about it, but I did it for years in my early training. I knew we needed B vitamins. I knew they were missing. I just didn't have the knowledge base or the experience. And when we got into this gene testing and this methylation, especially if you have several breaks, or you have
You're a crazy woman.
influence from both parents coming at you, it's just night and day difference.
So I want to get to this because I know that we're trying to keep this to 45, 60 minutes. I want to get to some of the questions that you specifically got on.
I do
online.
have specific. So leading into that is, as an OBGYN and sadly seeing so many women going through miscarriages and infertility issues, do you think that has something to do with methylation and being prescribed or told to take different types of vitamins they can't process?
We know that it is now.
What's that?
So the MTHFR and not having the right methylated vitamins, and it's one of the easiest ways. And honestly, at the end of the day, it was recurrent miscarriages that brought the whole MTHFR thing to light.
Yeah.
That was something that we were working on a
get
decade
so many
ago.
questions from young women that are saying, I've had either repeated miscarriages or a difficult time getting pregnant. And for those, you'd recommend that they take
I
methylated
recommend that they're immediately on a methylated
multivitamin.
multivitamin, and then also that they do a whole assessment of their diet. You've got to pull out the folic acid component in your diet. It's
Which is foods that are fortified or enriched.
right. Sugars, baked goods tend to be processed food. I tend to kind of, if it's white, it's not right kind of thing. If someone's just, what can I not eat? let's just start with flour.
Right.
Let's just pull, my two big things always are, let's pull out flour, let's pull out soda. Let's start you on a vitamin, and I make sure their vitamin D is included in that. And let me see in a month. And that right there,
Oh, yeah.
it changes their ovulation, it changes their menstrual cycle,
changes.
their sleep, their mood. As simple as that. And women, oftentimes, especially with heavy menstrual cycles, I will add in the iron, and I at least during their menstrual cycle. And I oftentimes will make sure that they're on some kind of iodine, Celtic sea salt, or some kind of extra substitute there. And that seems to be the secret. And then we look at their cycle and decide then, okay, do we need progesterone? Do we need to balance you? People tend to come to me at this point. They've tried a lot of things. So I'm getting some pretty sick people. So I kind of got to dive right in with a lot of people. But in general, if you're just at home going, I'm not sleeping, I'm depressed, I have hot flashes, I don't have any interest in sex, and I cannot lose weight no matter what I do, I recommend your B vitamins, your omega-3, vitamin D, an iron, and getting extra salt, like a Celtic sea salt. We don't want table salt. Remember, Celtic sea salt, and there's a lot of good ones out there. It retains about 76% of its mineral content.
Wow.
In this one. And in comparison, table salt's about 1%.
Yep.
So no wonder it's not very good.
Right.
So
And
we
we've
want
used that.
the,
We've used Baja salt, Celtic salt, and then we were recommending pink Himalayan sea salt for a while, but then we started reading all these studies about the level of heavy metals, especially in the sea salt coming out of China. So we kind of try to steer clear of the
I took a lot of shit on
pink Himalayan
Instagram for
sea
that.
salt. Yeah, you sure did.
But the video went viral because it does help people with migraines. Because if you're severely dehydrated, you were one of the you've taught us the sea salt Soleil trick. Can you tell us about that?
So what I like to do, just simple, easy, 1/4 teaspoon of Celtic sea salt in the morning. You can put it on food. It's just easy, really, just to throw it in some water and drink it in the morning. It's so good for your hydration status. It's good. It lots of minerals. It helps you because we forget that we're thirsty. We don't even know what it is to be thirsty anymore. It kind of resets your thirst. It really helps those adrenal glands get you up and get you going in the morning. And again, that whole balance we're talking about.
Okay. I love that.
Hey guys, as you know, I do not push products on my podcast or my social media unless I use them in my everyday life. This is one of those products. Most of us have a very difficult time meeting our protein needs, and certain protein sources like whey protein and others can be as little as 20% absorbable. This is 99% absorbable, and it has all of the essential amino acids that the body needs to build lean muscle, to recover, to improve our exercise performance, and most importantly, to repair after we have intense exercise. So this is called Perfect Amino by Body Health. It's, like I said, 99% absorbable. It only has 2 calories. Eventually, the caloric intake has virtually no caloric intake. It will not break a fast. It tastes amazing. You mix it in water. I take this literally every single morning. If you're working out in a fasted state, you have to take a full spectrum amino acid prior to your workout to preserve your lean muscle and make sure that you're recovering properly. And again, it will not break your fast. So the caloric impact is virtually 0. You get all of the full spectrum amino acids. It tastes wonderful. I use it every single day. You can go to bodyhealth.com/ultimate. That's bodyhealth.com/ultimate and look for the perfect aminos. They actually come in capsules if you're on the go, or it comes in several flavors that they make in a powder, which I love. It's flavored with natural means of flavoring, so there's no artificial sweeteners in here. So this is one of my absolute favorite products. Give it a try. If you're working out at all, you need a full spectrum amino acid. Go to bodyhealth.com/ultimate. That's bodyhealth.com/ultimate. I love their lab tested products. You can actually see the absorption rate for all of their products. They've got great electrolyte protein combinations. My favorite is the perfect aminos. bodyhealth.com/ultimate. And now back to the Ultimate Human Podcast.
Those were the ones I had for today. I mean, this was a huge.
Wow, I really ripped through a lot.
I know, we actually got through.
And I survived being the only
Quite
male
a bit.
on the panel in the estrogen sandwich.
I think the only piece that, since we did touch on infertility and miscarriages, maybe a little bit more on that. I know people will they'll hear the menopause and they'll hear, infertility or miscarriages. Any other advice that you have for women that are suffering with that?
Yes. So if you're not cycling normal and if you're having symptoms, it is really hard to get pregnant. So back up and start there. Those nutrients I was talking about and those food changes, get your cycles back to normal. There's ovulation kits out there. If you're not passing your ovulation kit, those are easy. You can pick them up anywhere. You check them days 11 of your cycle. So if you even spot or bleed, that's day 1 of your cycle. And then day 11 through 14, check those ovulation kits. And if you're not ovulating, you're not going to get pregnant, right?
Mm-hmm.
So for the infertility people, it's making sure you're ovulating. You can do that on your own. Make sure you're taking those few nutrients that we talked about. And then symptom-wise, if you're having symptoms, you still probably need to see your OB-GYN. And for the miscarriage person, it's traumatic. There's no doubt about it. No matter what week you are, it is traumatic. Whether people know you're pregnant or not know you're pregnant, and your hormones are all out of whack. Takes about 30 days to recover from a miscarriage from a hormone standpoint. So we definitely, the methylated vitamins and vitamin D are probably the 2 biggest things that I would
Methylated
recommend.
vitamins, vitamin D, good EPA, DHEA fish oil.
Right, the omega-3.
The omega-3 fish oil.
Right.
And to get the whites out of your diet and
Whites
the
out of your
sugars,
diet.
white flour, white rice, white bread, white pasta, and that is fortified or enriched. And then see how things go over the next month. And if things are not getting better, then get your hormones checked. Is that kind of a good summary?
Yes, it is. And remember, gluten-free junk food is still junk food, right?
Yeah.
So I always have to kind of put that caveat in because you do have to change your diet, and you want it to be those good fats, those really good fats. That's what women need. They need it to make hormones. They need it to make babies. They need it to get pregnant.
Right.
Good fats.
One thing that I admire about you, and always, I share this story with everybody that I introduce to you, is you've been an OBGYN for 27 years. You've delivered over 8,000 babies, but you weren't able to have a baby yourself. And so you adopted 4 from your patients.
I did.
And I love that about you. And I want to share
They are
that.
the 4 best things that the good Lord ever put on this planet, and they were exactly made for me. But I got to tell you, and maybe that's why I'm so passionate about this, they were tough years, and it was hard on my body. I had no direction. I mean, I'm a physician. I could get to anybody. I had top specialists, and I had no direction on simple things like taking 5-methylfolate, omega-3. My vitamin D level was 9. I would beg to differ that I have probably some of the most years of education number-wise.
Exactly.
Right.
And have access to pretty much whatever I want. And there I was, and it was miserable. It was miserable. Now, luckily, it's not like that today.
Right.
I mean, but it definitely was in my era. And I'm just so thankful that I was able to help other women, and I was able to help the women that gave me my children.
Yeah. I love that story. It
I
makes
like
me
that
love you
story
more.
too. She is an adoption magnet. She's adopted dogs. She's adopted cats. True story. She's adopted kids. If you
Her
need a
sister
home,
has adopted children.
yeah, if you need a home, just send to info@drsarda.com and she'll adopt you too.
I want to be adopted. I love it.
Every time I talk to her on a Zoom call, I'm like, what is that? She's like, oh, this is a new cat. I'm like, when did you get a new cat? Oh, it's
I
just a
do
stray.
rehome them,
Yeah,
just for the record. I'm not the cat lady running around with 50 cats.
Okay,
But I
then
do
you did the same thing with the
bring
dog.
a lot of them in, cats
Yeah.
and dogs, and I nurse them back, and then we find really great homes
But
for
you
them.
slowed down on the humans.
And sometimes I would like to do that with my children too.
Yeah. So if you're looking for a home, Dr. Sarda may have the place for you. This has been amazing. I'd really like to take some more questions from or inquiries from our audience, and we got a lot of interest in female hormone therapy and more about females that have been on this journey with us. So I'm going to try to invite some of the women that have had a positive journey with us on to talk about their experience. But if you guys are watching this podcast, you're enjoying this podcast, or things that we missed, or things that you would rather see us talk about with Dr. Sarda or some of our other doctors, neurologists, or what have you, please submit those at theultimatehuman.com. And we'll try to get a podcast episode surrounded by those. We end every podcast episode, this is a surprise question, with the same question we ask every guest we have on the podcast. What does it mean to you to be an ultimate human?
To me, I would have to say the first thing that came to my mind was balance and peace.
I like that.
Wow. That's the first time somebody said that. That's amazing. Balance and peace.
I like that.
Have you ever answered that question?
Have I ever answered?
I mean, I know you wrote a book called Becoming the Ultimate Human, so I guess you could say it's a 228-page answer.
I don't know that I have balance and peace in my life, though. It's a lot of chaos.
Oh, that was amazing. We really enjoyed
Yeah,
having
and
you on.
I definitely got to take a second to plug your guys' book too. It's amazing. But I've got the opportunity to have a little bit of a sneak peek at it, and it's definitely going to be a.
We definitely put our heart and soul into it. And I have the utmost amount of respect for anybody who's ever written a book before, because it is not, and like you get halfway through it and then you hate it and you start over, and then you hate the beginning and you hate the story, and then you want it to be
change your
entertaining,
mind
you want it to be educational. And then in our case, we have to cite references for every,
because
claim.
people are going to try to rip us apart.
Yeah.
Although, you know what, it'll be 98% of people I think will have good response.
Very good response. But we used a lot of real life
A
stories
lot of
from
evidence
real
based.
patients.
I think the thing too is I think in this day and age lots of things are anecdotal, but you've got to have evidence based medicine and evidence based decisions now.
All the stories are personal patient stories that have
And a lot of them are your
they're your patients.
Yeah, because we can't see patients, so most of them are your patients. So we should give you some credit too. But I hope you enjoyed this podcast. If you have any other questions you'd like to see us cover on a podcast, go to theultimatehuman.com. You can sign up for the newsletter there. You can actually pre-order our book. You can get the gene tests that Dr. Sarda was referring to. You can even get set up for blood work, or we can give you some information on what you might want to be asking your doctor to do when they look at your blood or you look at your hormone panels. And back again with another episode soon. And as always, that's just science.